Heart disease has been the #1 killer in the developed world, but today heart disease is increasing in its incidence in the developing world, especially in the Indian subcontinent and in India. This disease attacks in people in the younger age group in the Indian subcontinent, and also when it comes in greater severity. The Western population has been able to reduce their incidence of heart disease over the last 30-40 years. And from their experience, we can learn. And it is possible for us also to reduce the incidence of heart disease and the menace that it is causing to our younger generation. What can be done? How did the West reduce the cardiac mortality? There were two steps. One is the preventive aspects, by which you can reduce the occurrence of this disease, and the number two would be to institute early treatment by early detection. In relation to prevention, there are 5 tips that I can give you. They are: number 1 is to stop smoking completely. Smoking does considerable damage to the heart vessels, and it produces blockages in the heart arteries at a young age. Second thing I would advise is to do regular exercise. If we can do at least 30 minutes of even brisk walking every day, that will go a long way to prevent heart disease and its complications. The third thing would be to eat a sensible diet. Be wise in choosing what you eat. It has been seen that people living along the Mediterranean coast who consumes more of fruits and vegetables in their diet and less of fats and more of fish, they have a much lesser incidence of heart disease. So if we can also follow the same, having more of fruits and vegetables in our diet, less of red meat and fats and more of fish, that will help us in preventing heart disease. The fourth thing would be to have regular checkup of blood pressure, blood sugar and cholesterol. If these 3 things are detected early, abnormalities of these are detected early and treated, that will go a long way in preventing heart disease. These things are not, abnormality of these things do not always produce any symptoms. So unless it is checked, it will not be detected. Hence, it is important that we check these things at regular intervals. Also, we need to maintain an ideal weight. This will be the 5th advice. Check your weight regularly and make sure that we have an ideal weight and we do not have extra weight, extra fat on our abdomen. Having looked at the preventive aspects, we need to turn to how to detect this disease early. Early detection will be by knowing the symptoms. If one gets a heart attack, it need not always be severe chest pain. So if there is any symptom occurring anywhere between the jaw to the umbilicus and it persists for more than half an hour, see a doctor and rule out heart attack. The second thing would be, if anyone gets any symptom in the chest which comes on exercise and stops when the exercise is stopped, this could be a sign of a heart blockage that is developing, and this also needs immediate attention. Thus, if you can follow the preventive aspects and detect the disease early, thousands of lives can be saved. Prevention is always better than cure. Thank you.